오늘 또 재선기의 스페셜한 이벤트 독일에서 오신 닥터 수잔나 모시고 한때 큰 히트 상품이었던 아이콘, 지금도 히트 상품이긴 하지만 그 내용을 한번 촬영을 해보도록 하겠습니다.
혹시 자기소개를 좀 부탁드려도 될까요?
Yeah, good evening to everybody that's seeing us here. It's a great honor and pleasure for me to be here with these three wonderful colleagues, even though I cannot fully understand them, but we will make the best out of it. So let me briefly introduce myself. My name is Susanne Effenberger and I'm a dentist. I graduated in Germany from a university in the middle of the country. The city is called Göttingen, and currently I work as the head of clinical research in DMG, the company that produces and distributes ICON, and I'm also a clinician, so I use this in my own office, and I work as a lecturer in the University of Munich.
동환이 형, 그 통역 프로그램 좀 켜주시면 안 될까요? 네.
우리 외고 출신,
네,
외고 출신.
챗 GPT한테 물어보겠습니다.
아이콘 개발 배경에 관해서 저희한테 말씀을 해주실 수 있나요?
Yeah, that's my pleasure. It's actually a very interesting story. It was invented at Charité University Medicine Berlin by two young, very eager researchers that wanted to find a solution for early caries that can be treated without drilling. So the idea was to treat proximal lesions without drilling. So find something that can place a diffusion barrier within the lesion and thus hamper caries progression. And once they have finished their research with it, they were looking for an industry partner that helps them develop a product, and that was DMG. And we developed ICON together, like all the applications, the final formulation of the product. And once we have launched it, we also started to use it on vestibular lesions. And I think that's the topic we're gonna talk about.
오케이. 오늘 케이스를 많이 준비해 오셨죠? 3개 정도 준비를 쉬운 것부터 어려운 것까지 준비를 해 오셨는데 케이스를 직접 보시면서 말씀을 나눠보도록 하겠습니다.
So I prepared 3 cases that I brought for today. So I brought a very simple case with the initial indication, the carious white spot lesions, and an intermediate case with fluorosis, and also a case with combination therapy with composite restorations. So let's have a brief look at the first case. So here we have a very typical cariogenic lesion, how they form during orthodontic treatment. And you see a very classic white spot, proximal surfaces. So it's a simple 3-step procedure. You condition the surface with a hydrochloric acid, then you dry the surface, and you see a very typical chalky white pattern that is a little bit more chalky than if you have used phosphoric acid. And once you have this clinical appearance, then you can just infiltrate the lesions in some 2 steps for 2 minutes and for 1 minute, and then you can cover the cariogenic lesion. So this is one of the very first cases where we started to investigate the masking potential of ICON, and once we found out how we can treat carious lesions with it, we decided to look more for more complicated indications. And here we have a case that we have diagnosed as idiopathic lesion. So like from the patient's history and also in the molars, we could not find any sign of molar incisor hyperhormonization or fluorosis. So we diagnosed this as idiopathic lesions, and the patient wanted to have an improvement of their aesthetic appearance. So first of all, we identified the lesion and the areas of the lesion, also the margins, because that's a very critical part in the treatment planning. And then in the next step, and this is something that I personally consider as a very important step, is the use of transillumination. It's a very helpful tool, and it helps you to understand the full extension of the lesion, the location within the enamel, also the surface quality, And we see here in both trans-illumination pictures different areas of the lesions that show different light distribution patterns. We have a very opaque area in the marginal and in the central part of the lesion, and some more, let's say, translucent areas compared to the opaque areas in the center of the lesion. And this is a quite interesting finding, and also gives you a hint how the pre-treatment should be performed. In particular, in areas that show surface breakdown or particularly thick surface layers, it might be helpful to do a mechanical pre-treatment of the surface area, because otherwise you need to spend a lot of time in repeating etching cycles, and anyway, since the surface was defective at that area, you're gonna cover this up with a little bit of composite in the end. So here we see the clinical procedure. First there was a mechanical pre-treatment, followed by microabrasion for 30 seconds, and then we have the surface after the preparational steps. And we see here also both lesions show already some chalky appearance, but at this stage it was decided to start with the etching cycles. And in this case, here you see the visualization step with the trying step. So you apply the ICON Try material on top of the surface, and then you see the lesion diminish. So this is a very good indicator for the efficacy of your etching or pre-treatment procedure. And in this stage, we decided to perform the infiltration according to the protocol, but in lesions that you are not necessarily know for sure what is their origin, it's also a very good idea to give a little bit more time for the infiltration. Here we see the final result after the infiltration, and also the application of some composite layer, which I think is a very minimal invasive tissue saving procedure that really gives you a nice clinical result. And
멋지네요. It's very beautiful.
thank you. And also
지금 저 빗을 써서 진단을 할 때 제가 제대로 치료가 될 건지 안 될 건지 어떻게 예측을 할 수 있는지 한 번 더 설명을 해줬으면 좋겠습니다.
yeah, that's a very important question. Thank you for this one, because this is something we are currently working on also in clinical trials to really get a good outcome prediction, because I think that's the biggest challenge for dentists that are starting to use this technique. There is a certain classification depending on the opacity of the lesion during the trans-illumination process, and as a rule of thumb, I would say the darker or the opaquer the lesion appears, the thicker the surface layer is. Then you can choose appropriate measures to remove the surface layer, be burr, scalpel, abrasive disc, sandblasting, whatever tool works best in your hands, and you can see the light distribution behavior of the lesion, because you can control your progress using the trans-illumination. It doesn't make sense to etch and etch and etch. Just remove it and
뭔가 지금까지 우리가 잘못 쓰고 있었던 것 같아요. 제대로 배우고 쓰면 좀 더 효율적으로 쓸 수 있을 것 같아요. 수가가 어떻게 되는지.
Germany, where I would charge probably for the whole